We worry about lung problems, needing to be on the ventilator for longer than average period of time, pneumonia after surgery, fluid all in the lungs, those type of things. We try to get that breathing tube out very quickly, but if that's not possible, we'll do things to try to help prevent those, okay? Once that breathing tube comes out, we'll get you exercising your lungs, okay? We'll get you sitting in a chair very quickly. That helps open up the lungs. We're gonna give you a special device by your bed to breathe in and out of. That helps open up those air sacs and prevent those things, okay?
Should I bring like extra cushion because my back is bone on bone and sometimes I have to have something, so.
Do you have a specific cushion at home that
No, I
works
just
well?
use something.
Lots of pillows?
So I can just use the pillows.
We have lots of pillows, so if
Okay.
you need more pillows, just ask.
Okay.
Okay, yep, we should be able to take care of those
Okay.
things. Okay? We worry about the wound not healing. The bone edge is not healing together, the skin edge is not healing together. More common in people that suffer from diabetes or kidney problems, so we're watching that closely. That's one of the reasons we put all these restrictions on you after surgery with lifting and
Yeah.
pushing and those type of things.
Okay.
Do you drive?
Not anymore.
Okay, good. We don't have to worry about that.
They stopped me.
Well, that's okay. They want to chauffeur you around. It gives them more time to spend with you, right?
Stopped me.
Yeah. We worry about heart arrhythmias, the heart not beating properly after surgery. That can be pretty common after heart surgery. We see that about 30% of the time. That's why we put those temporary pacemaker wires in. Most of the time, it's something that we can fix with medication. Occasionally, we'll get our heart rhythm specialist to come and evaluate you. If after surgery, especially after valve surgery, if your heart isn't beating properly, sometimes that can lead to the need of a permanent pacemaker. That's usually a decision we make 3, 4, 5 days after surgery, okay? Well, it's something we'll be watching. It doesn't happen very often, about 10% of the time.
So if that happens, you got to open me up again?
Not like this. So they put a little pacemaker in a pocket right underneath your skin, and they pass those wires through a vein down into your heart. So not a big procedure like we're gonna do, okay? I don't want you to lose sleep over that, okay? The chance of that happening is low, and if it needs to happen, we'll talk to you about it when the time comes, okay? But there's certainly a risk, okay? Those are the biggies. It's heart surgery. Just about everything that you've heard that's bad about heart surgery can certainly happen, but
I haven't heard much.
so, well, I just told you about the big ones,
Yeah.
okay? But we're in a business of talking about risk versus reward, okay? We know there are some risks associated with taking you to surgery, okay? All of the things that we just talked about, you know, if we added them all up, you know, we're probably talking a 20, maybe 25% risk of something happening along your hospital stay, okay? 75% of the time, you'll be just fine. If we leave this condition untreated, we don't do anything and just let nature take its course, you'll either have a big heart attack and die, or you'll have a heart attack and that heart muscle will continue to weaken to the point where you may not even be able to walk across the room, you know? So the fact that you're already telling me that you feel winded all the time when you get up, it tells me that, you know, these symptoms are pretty severe.
Like 2 weeks. Started
Yeah.
doing that.
So,
Okay.
okay? Do you have any questions?
No, I had plenty.
Do you have any questions about what we talked about?
I think
Okay, you feel like you understand what we're getting into?
Yeah.
You know, Dr. Miner, he's really good at putting stents in, and if he thought that was possible, he would have done that.
Yeah, I figured.
And the other option is just doing medical therapy, trying to control this with medicines. Because of your low blood pressure, we're pretty limited on the medicines that we can give you.
And then when they told me to drink salt water,
Yeah.
Dr. Nagopinath told me.
Yeah, I
"No,
bet
don't
Dr.
do
Gopinath
that."
probably said, don't do that at all.
she doesn't remember about the aorta, the valve.
The valve, yes.
She doesn't remember Dr. McKellar talking to her about
I
it, but-
remember him asking something, did anybody talk to you about your aorta? And I said, no. And then he said something like, okay.
Yeah,
So I don't remember.
it's bad enough that we need to replace that while we're in there, okay? It would not be a good idea to leave that untreated,
that's what
because
it
I
is.
think that's a major cause of what's causing your
It's
symptoms.
either I didn't hear it or it just had spaced out
Yeah.
already.
So the mitral valve also has calcium on it, and those leaflets are a little stiff. It's not severe. We will look at it again tomorrow during surgery, but we're going to do everything we can not to touch that. Trying to do 2 valves and bypass surgery would really increase the risks. Instead of the 10%, you know, 25% overall risk that we're talking about,
75% like that.
we those numbers would probably be flipped. You know, we'd be talking significant risk. So unless we get in there and it just looks absolutely horrible, way worse than the studies that you've had, we would plan on leaving that alone. Okay?
Okay.
All right, so I need your permission to work on you tomorrow, okay? So Dr. McKellar's gonna do coronary artery bypass grafting, and he's gonna do an aortic valve replacement, okay? Those are the two things we're planning on, okay? And if you're okay with it, I'm gonna have you sign on this line for me right here. Thank you very much. Okay, and Dr. McKellar's in clinic today. I'd imagine he will come by and say hello, answer any other questions you might have here in an hour or two. Okay?
I think I have one question.
Okay.
Good.
Hi.
I'm just here to get her for a couple X-rays.
Perfect. I am done.
Perfect.
So now everybody else is starting to come. You're going to get a tour of the hospital. You get to meet a lot of new people. Okay? It's a pleasure meeting you. Okay? Nice meeting you. Take care.